Hi, welcome to Therapy Playground. I'm Julieanne.
And I'm Mary Beth.
Today, Mary Beth is going to be discussing a little bit about how a speech-language pathologist can specialize in literacy. And I know some of you are thinking, literacy? You know, what can a speech-language pathologist not do? I mean, we work with feeding, literacy. What else is there? Well, there are lots of different types of therapists, and, many therapists specialize in many different things. You have the therapist that is really good with language and they focus on grammar, and you have the articulation therapist is really good with teaching kids sounds, phonological processes. You have the therapist, that believes that oral motor weakness can affect speech. Not all therapists work on oral motor. You have the auditory comprehension therapist who, work with therapeutic listening and those types of therapies. And then you have the literacy therapist. So, Mary Beth, can you tell us a little bit about the literacy therapist?
Yes, well, basically when we're talking about speech pathologists covering such a broad spectrum of disorders and such a broad spectrum of therapies, the question really comes into play when you're talking about children with severe speech and language difficulties that might have difficulty being understood by their peers. They have difficulty expressing their thoughts, even having the confidence to raise their hand in the classroom. They have secondary problems with their social skills at school. And last and often overlooked by the speech pathologist is their reading and their reading comprehension. And basically what ASHA, which is our governing body for speech pathology, has said about that is that when it's the case of a severe communication impairment or a child that has multiple disabilities, it is the speech pathologist's role to step in and provide direct treatment. So what we have to look for as parents and as therapists is identifying those children so that we know when and how to give them therapy and to not overlook that. So some of the things that you can look for in those children are starting at an early age. Is it now a predictor of whether they will have a reading impairment later on? And some of those things would be if they were a late talker, if they had severe phonological processes, meaning they follow rules that they make up versus following the adult rule. So it's different than just articulation if they were very severe at a young age. Being able to name their letters and their letter sounds at an early age, or some of the skills that we don't really think about, like drawing a picture and telling mommy what the picture is of. Those are all indicators of what their literacy and their ability to learn to read later on are going to be.
And it's very difficult when you have a child that is so involved. They have a language delay, they have a phonological delay. Their parents are focused on getting their child to speak, getting their child to where they can understand them, and the literacy portion is overlooked. And then when they get into school and they're in kindergarten, they're learning to read, they're falling behind, and you wonder why. Well, especially if a kid has a phonological process disorder, they're not processing the sounds right. It could be very difficult. So if a child does have problems with literacy, is that a different treatment session, or is it targeted altogether? How would a speech therapist do this?
Well, the question is, one, if your child is having difficulties with some of those things, how do you know and when do you start that kind of therapy? And the question is kind of multifaceted. If it is a young child, some of those things can be worked into therapy on the side, and most of that at a young age is really something that the parents can be doing at home. But it is our role as a speech pathologist to tell the parents, because it's overlooked by speech pathologists, which means it's definitely overlooked by a lot of families that are concentrated on the real severe problems that they see right then with their children. So it is at an early intervention stage our responsibility to tell parents different things that they can do. You can practice naming letters, which a lot of parents do, but then the other side of that is the letter sounds. So doing simple things like the apple song that so many of us see that says apple, apple,
and the kids love that.
The kids love it, and it's simple enough, and it teaches the sound to letter correspondence versus just the name of the letter, which is what we see a lot. Kids can name it, but they can't identify what sounds go with it. Another thing at an early age, having the child hold books, understanding where to point to a word on a page, understanding to hold the book the correct way instead of upside down. Those are all things that just add to their print awareness and add to their ability to understand what literacy is. When you get into the preschool to kindergarten level, you can do more of sound segmenting, doing parts of words and separating and finding the first letter of a word and the last letter. But once you get into an older age, then it becomes a whole different ballgame of things that you have to be looking for in different ways. And that's when it becomes the speech pathologist's responsibility in therapy, is when we can take over.
Okay. So what you're saying is that there wouldn't be kind of like a separate therapy session. You would have to target this, with the other goals and kind of incorporate literacy activities into the treatment to help the kid progress or help them learn.
Exactly. So what we're talking about when you get into the older child, and once again we're talking about a child that has more than likely severe speech and language or just severe language difficulties, and this is probably a child that will have difficulty with their syntax, using the markers at the end of words to indicate what happened yesterday, what's happening today. We're looking at a child that, like we said, probably has difficulties with pragmatics, all of these different areas. So the question then becomes, how do you know as a parent and as a therapist that the target of your therapy should be literacy, or it should be grammar, or it should be any of these other things? And the answer from the literacy clinician is to target all the things together. And the way that you would do that is to do your reading activity, but through reading, you can also target your conversational skills by reading about what is happening and then applying it to daily life. You can target your vocabulary skills during a reading activity by learning new words, identifying new words, and then learning the meaning, which is also very good. A lot of the time, those words that they don't know are going to be the ones that they are having difficulty reading. Yeah. So they're all tied very closely together. It's just kind of taking a step back and making sure that we know what the family's needs are and that the family knows that we can help in that area.
Yeah.
So most of the time it's just not brought to our attention.
Which is, it's really interesting, because we have 30 minutes of a session most of the time, and it's really difficult to target the 4 or 5 goals we have, plus include literacy activities. So if you're able to do that all together, it's great. A lot of us like to send home homework as well. So you could send home, reading activities, like you said, to the parents that, target their language goals as well as promote literacy. So that's really interesting. One question I have is, for a child, is it more observation and questioning with their parents and their schools to find out if they have problems with literacy, or is there testing that we can do to determine if they have, difficulties?
There is standardized testing that can be given. Most of the time it will be given secondary, so it is given after either the therapist sees that there are concerns or the parent reports that there is concerns. It is not normally given as a blanket assessment, so that's why it is crucial for the parent to know that we are a resource that they can use, because we can give assessments and it will break down what areas are the weakness and show us whether it is comprehension or if it is reading and the phonemic awareness, the fundamentals. And when it's the fundamentals, then we can take reading and break it down to a level, just like in all other therapy, that the child can achieve at. And boost their confidence, give them word attack skills, and really
word attack. That's different you say that, because I remember that from grad school. And I remember learning about ways to incorporate literacy. From our literacy therapist, who was our professor. I actually did give an evaluation the other day for a kid who was having trouble with language. and articulation. And it turned out that mom said that the child was having trouble reading in school as well and was falling behind. So I recommended her for a literacy evaluation. We have her scheduled for one at the Kane office. So hopefully that therapist that she ends up with will find ways to incorporate literacy into the treatment to be able to help that child out and the parent out. What else can parents do?
Well, like we've talked about, all of the things that you can do at an early age. And then also there are things that you can do even if your child is in school and right now your child is not getting that kind of assistance from the speech pathologist. There's a resource that I really like to use, and I use it in my therapy. It is called the Florida Center for Reading Research. It is designed for the state of Florida. They actually use it in all of their schools, and it's designed for teachers. So they are games, they are activities, but they're broken down per grade level and per topic. So,
that's cool.
So you see what area of weakness the child has, and then you can break it down into little skills that they can achieve. And I really like this resource because it's something that we can do in therapy and then send it home with the parent, and they have access to it. It's not something that we hold and they have to get it from us. It's something that they can do at home, and we can really work together on it.
Yeah, are they like computer games or they're printouts?
They're printouts. They're PDF files, but most of them can be laminated and made into board games.
Oh, great!
Different things, and they are made for a group. So if you have a group of children or all of your kids at home, they can play the game together and help their siblings, that kind of thing. But that is a free resource, and it's the fcrr.org, and it goes all the way from pre-K up through 5th grade reading and comprehension. So it's a really great resource for parents.
That is really great. Thank you so much, Mary Beth, for explaining that to all of us. If you have concerns about your child's ability to read, if they're already receiving services, talk to your speech-language pathologist about this and talk about ways that, they can incorporate literacy into the treatment session, or maybe even schedule an evaluation to determine if, they do have, phonological awareness problems. If you do not currently receive services at Therapy Playground, you can call us. Our website, therapyplayground.com. You can find our email address and our phone number and our address there. You can come stop by or give us a call and schedule for an evaluation. Thanks for watching.